Well, hello and welcome to Itentiv Healthcare Solutions webinar. We're excited to share our next-gen add-on solution called ChartGuard with you today. My name's Tom Seco and I'm the Business Development Manager with Itentiv. And I'd like to take a minute to explain some of the process for today's presentation. First, I'd like to mention that this webinar is going to be recorded and we'll send a copy of the slides out along with the recording within the next week. Next, for those who are not familiar with Itentiv, I wanted to share a bit of who we are with you. We specialize specifically in next-gen healthcare. We're good at getting data into, out of, around, and through next-gen. Basically, our goal is to make delighted clients by helping them get the absolute most out of their next-gen software investment. We're passionate about providing solutions for our healthcare partners, which in turn help them enhance the patient experience and help them maintain a financially healthy practice. To sum it all up, we do everything next-gen. And we also have add-on productivity solutions for next-gen, of which we're covering one of them today, the ChartGuard product in this webinar. So back to today's presentation. At the end of the presentation, we'll open it up for questions from you, and we'll answer any questions at the end that you may be able to type in the questions area of the webinar control panel whenever they occur to you. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. And if you experience audio issues, please use the chat box to let us know so we can resolve them. And again, any questions can be entered into the questions box. So as I mentioned, my name's Tom Seco and I'm the Business Development Manager with Itentiv. And with me on the phone today for the webinar is Joel Scholes, and Joe's our Vice President of Product Solutions. And what that means is that he and his team are the people that actually built this great program called ChartGuard. So again, thank you for attending our webinar today and about being prepared for unexpected downtime situations so you can access your patient records during the unexpected system outage. This is the agenda of what we're going to cover today. What we'll cover today is you're going to understand why practices invest in this type of solution. We'll talk about EHR dependencies. We'll talk about how it works. And what I'm going to do in the middle of the presentation, when we talk about how it works, I'm going to turn it over to Joe, and Joe's going to take you through how the software works. We'll show you how what the output is that's generated by ChartGuard. And like I said, we'll answer any questions that you have at the end. So what we're talking about today is unplanned downtime to ensure that your practice, your health center, can be prepared for it. So your physicians and providers can continue to see their patients while your IT team is working to bring NextGen back online. There was a survey that was conducted a few years ago that stated 96% of the institutions that were reported on the survey reported at least one unplanned downtime situation. And 70% had at least one unplanned downtime lasting 8 hours or more. So downtime does occur in the healthcare environment. It can occur for an extended period of time, and when it does occur for an extended period of time, it can have a significant impact on the organization, as you may know if you've experienced a downtime situation. We all know that our EHR systems are based on complex technology. We have servers, we have workstations, we have tablets, we have scanners, we have local area networks, we have T1 lines, fiber lines, wireless routers, VPNs, we have internet connections, power systems, cooling systems. Behind each one of these pieces of hardware, there's also software that runs behind it as well. So the combination of the hardware and the software together, any one of these components can have an issue with it. And when one of those components does have an issue, it can affect everything in the chain. And when we lose access to our EHR system, it impacts our practice, it impacts our health center. Quality of care can be impacted because we don't have access to the patient's health record and we may not recall all of their history. So then we have to start asking questions, and maybe we have to start asking a lot of questions. And when we start asking a lot of questions, it can lead to taking more time than usual. And when we take more than time than usual, it can lead to lower productivity. And when we have lower productivity and we're taking more time, we can lose revenue by that as well. Some patients may get impatient with it and end up leaving and want to come back later just because the wait has gotten longer. So a lot of things can occur when we lose access to our systems. Like I said, impact on quality of care, impact on productivity, impact on revenue. This is a slide that just shows various outages. Because we become so dependent on our technology and it works nearly all the time for us, we tend to put how outages occur in the back of our mind and not really think about it. So, you know, this list here shows the types of outages that can occur and why they occur. These are, like I said, some outages that have occurred over the past few years. You also probably know that Facebook went down last week, had a significant outage, impacted Facebook, Instagram, and all of these organizations are built for having uptime 7 days a week, 24 hours a day, 365 days a year. And if they're built for that kind of uptime with the amount of users that each one of these organizations have that you see listed here, if they can go down, you know, we can go down. As you see here, these outages can occur for various reasons. Some are mechanical, some are computer hardware based, some are software based, some are nature based, some are caused by humans, humans with good intentions who just make mistakes, and some are with humans who have bad intentions and who want to cause disruption and chaos. So really, basically, to sum it up on this slide, you know, when you have inaccessibility to your computer system, regardless of what the cause is, it can create chaos for our EHR users and organizations, healthcare organizations. There have been studies done on downtime within the healthcare industry, and some of those studies have shown that downtime can cost as much as $488 per hour per provider. And if you extrapolate that out, for a 10 provider practice who's down for 4 hours, it can cost as much as $19,520. So it can be quite expensive when you incur a downtime situation. And because we have these situations that can affect our EHR systems, HIPAA has a clause that says we should have some type of contingency plan or plans for responding to various emergencies or other situations that can impact our EHR systems. So what are some of those options when we're dealing with an outage that we have available to us? Well, we can implement redundant technologies like additional servers, additional data centers, additional power systems, but that can be costly. We can close down a practice or close down a location within the practice temporarily that's been affected by a downtime situation. We can go to hosting. You know, some organizations think that who house their own servers think that going to hosting is a viable option for them. But if you really think about hosting, you think about the redundant technologies that I just mentioned. As I mentioned earlier, any point in that chain can have an impact or some type of an outage with it, and can cause the whole system to come down. We can go to paper charts, but that's becoming more and more difficult for us to do as we've become more and more dependent on our electronic health systems. And another option is we can implement a solution that ensures that you are prepared to handle a downtime situation. So as we reflect on just what I talked about, that our systems are complex, that our systems are dependent on many components, that downtime is caused by unexpected events which can happen beyond our control. You know, what are and explore what our options are when a downtime situation occurs. You know, we should be asking ourselves some questions and thinking about this. And here's some questions that that we put together that you should be thinking about as you think about a downtime situation, your downtime situation and a solution to that. Starting in the upper right-hand corner and working around clockwise, you know, do I pursue an uptime solution, or do I pursue a solution that enables me to continue on with my business until NextGen comes back online? So, do I put my money into more hardware, more software, more redundancy, technology, or do I pursue a solution outside of that that allows me to continue to continue on with my business? What type of impacts that a NextGen downtime incident can have on our clinic, on our health center? Those impacts, can I have an impact of quality of care? Can I have an impact on my revenue? Can I have an impact on my productivity of my staff? Can I have an impact on my patient satisfaction? So just identify what those impacts can be if you lose access to NextGen. And then think about how significant can that impact be to our clinic based upon the duration of the downtime incident. So meaning if I'm down for an hour, what's that impact to revenue? If I'm down for an hour, what's that impact to productivity? If I'm down for an hour, what's that impact to the quality of care that I'm providing my patients? If I'm down for an hour, what's that impact to patient satisfaction? If I'm down for 2 hours, what's that impact to revenue? What's that impact to productivity? What's that impact to quality of care? If I'm down for 3 hours, just kind of scale it up and kind of see what that impact is. So you get an idea of how your practice can be impacted, how your health center can be impacted by being down for an extended period of time, and where that impact hits within the organization. Am I going to be reactive or proactive in my clinic's preparedness for downtime? That meaning I have had a downtime situation, I've experienced it, now I'm looking at being reactive to make sure that I have a solution in place when I have a downtime situation. Or I'm being proactive, meaning I haven't had a downtime situation yet, but I want to be prepared for its eventuality. When was last time that we reviewed our downtime preparedness and business continuity strategy and plan? Do we review it every year? Have we reviewed it every 6 months? Do we review it every 2 years or 3 years, or have we never reviewed it, or do we not have one in place? So think about that as well. And then how do I minimize the loss? How do I minimize the disruption when a downtime situation happens? So how do I minimize when I'm down? How do I minimize the loss to productivity, the loss of revenue? How do I minimize the disruption to my physicians and my providers seeing their patients? How do I minimize the disruption to the workflow? And when we experience an unexpected downtime situation, who will be the first to notice that there is no access to NextGen? Would the first people to notice it, would it be the physicians, the providers? Would it be the front office, the back office? Who would be the first to notice such a situation occurring? So these are just some questions that you should be thinking about as you're thinking about downtime, as you're thinking about solutions to your downtime situation and its impact to the organization. So downtimes are unavoidable, and prolonged ones can significantly impact your practice, your health center. So it's essential to have policies and processes and procedures in place, both for the clinical staff to continue to provide quality of care during these times, and for the information technology staff to recover from the downtime incident. And as we as an organization, Itentiv, were asked by clients in the past, we have downtime. We don't have a solution in place. Is there something that you have in place, or is there something that can be developed that would allow us to continue to see our patients when we lose access to our NextGen system? And we worked with our couple clients in the past to develop ChartGuard, and that's what we're talking about today. So it's really a client generated and a client collaborative effort between us and previous clients. So ChartGuard is a cost-effective, easy-to-use business continuity solution. It ensures that you are prepared for a downtime situation at each of your office locations or clinic locations, and that you have access to your patient charts during EHR downtime. So I'm going to do now, I'm going to turn it over to Joe, and Joe's going to talk about how ChartGuard works and take us through the next couple slides.
Thank you, Tom, and thank you to our attendees today. So what is this ChartGuard thing we've been talking about? How does it work? How does it provide access to your clinical information when you cannot get to your EHR? We developed ChartGuard a little over a decade ago, working with several NextGen sites that were in areas that were hit by storms quite often. So it was common for them to lose access to their EHR. In fact, they wanted a solution that wasn't just going to be another mirror EHR in the cloud, but it was going to give them their data locally at each of the locations without the complexity of having a mini EHR installed alongside their full EHR. So in working with them, what we came up with was the idea to extract the data from NextGen, create a PDF file of the data, and push that out to each of the locations. Now that PDF file of the clinical data will mirror the patient chart that we used to have several years ago in the manila folders before we went to EHR. So this way, it's creating those charts each night overnight. It's determining what charts to create by looking at your appointment schedule. So that'll tell it which patients to create for the PDFs for, and then also looking at the appointment itself and where that patient is scheduled to present. And that tells it where to copy each of those patient chart PDF files to. So we've built all the complexity in the back end in this ChartGuard engine that runs alongside your NextGen database. And it's able to pull in quite a bit of the clinical information, create these PDF files, and copy them out. It'll look several days forward in your appointment schedule typically, in case you have an outage that spans overnight. Maybe it's an outage that's late in the afternoon and the tech isn't coming out to the next morning to fix it, or maybe it's just a bigger regional outage that's going to take a while to get fixed. So if we go several days out, this way you'll have the appointments for the next 3, 4, 5 days. So those will be out at each location on a designated computer. So that way it's already out there when the network goes down or when your EHR goes down or when some other type of outage happens, but you're still able to see patients. So we've built all the complexity in the back end, but the front end, when each of those locations that has an outage is technologically challenged, we've made that front end really simple because these are the same kind of PDF files we're downloading contracts and other forms for on the internet. And there's a PDF reader available for nearly every computing device out there. So you can make them available to your providers on tablets, on the computers they normally use, just any device that can be put on the local network. Additionally, the great thing about PDF files is they print out exactly like you see them on the screen. So if the network is down within that location, but the computer that has those charts is still up, you can have a locally attached printer and just print those charts to paper as the patients come in. And of course, in addition to the charts for each location, we give you an appointment listing for each location too. So Tom, if you want to go to the next slide.
Okay.
So what we see here is what's available in the charts themselves. So it's going to be your typical NextGen information, your module data, such as allergies, medications, labs, results. So those are going to be in there. Those are going to be in grids. Tom will take you through that in just a minute. The other cool thing is we can also pull NextGen EHR documents. So that's going to copy your template data that you're looking for into the PDF file. We can also pull critical information that you need from ICS. So if you're depending on radiology or various scans coming back in, or other forms that just come in over a document interface and you want those to be part of your downtime chart, you can specify that category of item within ICS and pull those ones in too. So it really becomes a holistic view of the patient. Now, the good news is if you've been seeing the patient for 10 years and you have an outage, we don't need to give you all 10 years worth of that history typically. We just need to give you the recent history. And as part of our implementation of ChartGuard, we'll work with you to determine what that recent history looks like, how far back it goes, what types of items are in it. And then you can go forth with that and review it with your clinicians and then roll it out. So Tom, I'll go ahead and turn it back to you.
Okay, thank you, Joe. So as Joe mentioned, you can generate how many days in the future you want to go. You can generate, determine the depth of information that you want on the chart as well. So what I'm going to do is I'm going to show you what the files look like that are generated by ChartGuard. And here you're seeing the appointment listing that gets generated by ChartGuard. So you see here let me expand this up here a little bit. You see here the name of the provider, the date of the appointment, the time of the appointment, the patient, and what they're coming in for. So the front desk knows who's coming in, what they're coming in for, and who they're coming in to see. And then let me show you what the chart looks like. So as Joe mentioned, this is a PDF file that gets generated. And you see here in the beginning is the demographic information. So the information about the patient, responsible party, the insurances. And as you scroll down, you begin to see the module information. So here's the allergies in a nice table format. You'll scroll down to the next section. You can see the active medications in a nice table format. So it's all nicely formatted in tables from page to page, section to section. Here's the labs. And again, you can control the depth of the information here by saying, give me the last 6 labs or give me all the labs in the past 8 months. So you can control the depth of information that way. What's also nice is that we bookmark the document as well. So it makes it much easier for the individual to go to a specific section. So if they just wanted to go to immunizations, they could click on the immunizations bookmark and go directly to that section within the PDF file. As Joe mentioned, we also bring in documents, and we can bring in ICS images as well. So you can easily scroll from top to bottom if that's how you prefer to look at the information, or you can go directly to the section that you want to see based on the bookmark. As Joe mentioned, PDF file, so it's easily readable from any type of device, whether it is a desktop, a laptop, a tablet, a smartphone, whatever has a PDF reader on it, you can easily get to the information. So that's what the output looks like. This is just a testimonial from one of our clients who uses ChartGuard. This particular client is an orthopedic practice in Tennessee, and they took time to write us a quick email about their experience using ChartGuard. They're a fairly large organization now. They have about 20 locations, and they've been using ChartGuard for several years. But just after they purchased ChartGuard, I think it was like 6 months after they purchased it, they experienced an outage at 2 of their largest clinic locations. And prior to implementing ChartGuard, they typically closed the clinics that were affected by an outage and turned away their patients. With ChartGuard being implemented, they've been able to see their patients with minimal disruption using the appointment listing that I showed you and the PDF chart files that are generated by ChartGuard. So they were able to keep the clinical side functioning while their IT team was working to bring NextGen back online. And as you see from the quote here, their physicians were quite pleased with the ChartGuard being implemented. So with regards to next steps, if you have any questions with regards to the webinar today and ChartGuard, like I said, we'll answer them here at the end. You can type them into the chat box there. If you want to have a more in-depth discussion about ChartGuard and how it would fit within your organization, and we could talk then and ask, and you can give you an opportunity to ask questions as this specifically pertains to your organization and your current processes. You see my contact information up here and Joe's contact information up here. Feel free to send us an email or give us a call, and we can schedule time to talk with you or answer any questions that you have. But right now, what we'll do is we'll take any questions that anybody has.
Tom, I have one here that came in. The question is, how do you handle custom KVM? So you're not on KVM, you've created custom templates. What we recommend in that case is to generate EHR documents with those data elements in them, and then we'll just pick up those documents. So that makes it easy to kind of pull that information in without having to do custom programming.
Okay, there's another question here, Joe, that is, what's the implementation time for ChartGuard?
The implementation time is pretty straightforward. Normally there'll be a kickoff call within a week or two after signing the contract, and then we'll move at your pace. The initial installation takes about 90 minutes to get ChartGuard set up, configured with the standard base configuration, and then we'll work with you to tweak that configuration. Those items in the chart we were looking at, the depth of the information we're going to pull into the chart. So really we'll work as quickly or as slow paced as you need to based on your time to fit this project. And normally we can have it up and running within 4 weeks or less.
And another question came in with regards to security. Can you talk about the security?
Mm-hmm. When the charts are created, they're pushed down to a PC at each location, or really any computer. Typically it's a PC. We have recommendations and guidelines that we'll provide you for this computer, that the file system on it be encrypted, that the folders it goes into be locked down, that Windows file system auditing be turned on so that you can see who's accessed which files. And that'll help you create a secure rollout for ChartGuard.
And it looks like this might be the last question. Is the patient information staying out in the system forever?
One of the great things about ChartGuard is that it cleans up after itself. So after running ChartGuard for 6 months, you don't have 6 months worth of data out on that PC. You obviously could if you wanted to, but typically you don't want to risk filling up the hard drive, and you don't want to risk the exposure of that information being outside the EHR. So what will happen is if you set, say, a 4-day window with ChartGuard, it's going to keep that 4-day window of information on these computers at the locations and just kind of clean up after itself as it adds new data. So that way you don't accumulate information you don't want out there. You only have what you need for the outage, which fits well into HIPAA, where you only want to have access to data on kind of a need to know basis.
Okay, that looks like that was the last question that I see. You have any questions, other questions that you see, Joe?
No, that was it for today.
Okay, all right, good. Like I said, if you have any other questions, feel free to contact myself or Joe, and we'll answer any questions you have. If you'd like to have more in-depth discussion about ChartGuard and how it fits within your organization, you can contact me as well, and we can schedule time to go through that. So with that, we'll close down the webinar, and thank everyone for attending it today and spending a half hour with us to learn more about downtime preparedness and our ChartGuard solution.
Thank you, everyone. Have a great day.
Have a great day.